After months of waiting, children under the age of 5 could get their COVID vaccine this week. The change now makes more than 25 million American children eligible to get the shot. And the news cannot come soon enough now because variants like BA4 and BA5 are making their way across the country. We're going to try and get to all of your questions right now on the Morning Medical Update. Good morning, everyone. It is Monday, June 20th. Thank you so much for joining us here on YouTube, Facebook, and on Twitter. Coming up, a huge milestone at the University of Kansas Health System. A live look now at our Women's Cancer Center at 435 and Knoll, where we will perform our 200th intraoperative radiation therapy, benefiting early-stage breast cancer patients. We will hear from the doctor about how this IORT is transforming breast cancer care for these patients. Dr. Dana Hawkinson joins us in about 15 with the latest COVID numbers, and they are creeping up. And we are just days away from children under the age of 5 being able to get their vaccine. What parents need to know to prepare. Please send in your questions. They are very important to us, and we want to try to get to as many of them as we can. You can send those in to YouTube, Facebook, Twitter, and to the Medical News Network. You can find links to all of those right there on your screen. A live look now at downtown Kansas City, where in many spots across our area, temps for a second straight week will be in the upper 90s or reaching triple digits. Although heat-related illness can be prevented, the CDC reports more than 700 people a year die from it in the United States. And did you know even some medications can make you more sensitive to the heat as well? Dr. Ryan Jacobson, an emergency room physician here at the health system, tells us the importance of staying hydrated.
Focus on risk factors. If you are not acclimatized to the heat, this is high risk for you. If you don't have a good athletic condition, if you have what we would call someone who's not in good physical conditioning, that's a risk factor. Extremes of ages, so the elderly and the little kids, so people who are locked in cars, kids who can't seek out shelter, they're just sitting in a car seat or in some sort of carrier, they can't tell you they're overheating. I mean, everybody's hydration requirements are unique to them, but in general, people are walking around and working dehydrated. In general, I would say the population is very dehydrated. Sweating is unique to the individual as well, and we refer to people who get rid of a lot of salt when they sweat as salty sweaters. And then there are people who aren't salty sweaters. But one of the easy, quick ways that people generally tell to look at is if you look at the brim of your ball cap and you can see that old dried sweat that's all white and chalky looking, that's salt. Those people tend to get rid of more salt when they sweat, and they may be somebody who needs more of an electrolyte replacement solution, something that has salt and electrolytes in it, like a sports drink.
Great advice this morning. Soon, kids under the age of 5 will be able to get their COVID-19 vaccine. But kind of a mixed bag on if parents will take their kids in right away or at all. Researchers with the Kaiser Family Foundation find only 18% of parents would get their child vaccinated as soon as possible. 40% of parents of young children say they would wait and see before vaccinating their child, while 27% say they would definitely not vaccinate their child against COVID-19. Joining us now to talk all about this is pediatrician Dr. Ryan Smith, Dr. Kevin Ault, OBGYN, and member of the CDC's Advisory Committee on Immunization Practices. And also joining us is Mallory Leach, nurse practitioner, nurse manager with pediatrics. So thank you everyone for joining us this morning. Glad to see you. Dr. Ault, I want to start with you because many parents would say this has been a long time coming, but what has been the delay? People have been asking, why is it taking so long for this age group?
Well, the process is the same for this as it is for the other vaccines that we've given emergency use authorization to. Basically, the clinical trials have to be complete, and it takes a little while to analyze that data, and there were dosing parts of the data and also follow up to see if the vaccine worked. And so all those things take time. We're always in a hurry, of course, to get these out, but there's a process that was worked through, and that happened this past week.
So we just mentioned that large number of parents are going to wait and see. They're taking that approach on it. But that 27% of people who say they definitely will not get the vaccine for their kids under 5. We were just talking before our program, and you said I always ask you what I should talk with you about. And you said you were really surprised at the death rate of kids under this in this age group. So talk us through that. And I might even have you pull up that graph, because that might actually have you do a show and tell for me.
There were 132 slides, and I printed out one of the most important ones. This little peak here is the Omicron peak from earlier this year. And I said, parents already know this. I think that the first 3 months of this year, there was plenty of COVID in the schools. And so I think the thing that surprised me is that COVID is consistently the 4th or 5th cause of death in children under 17, including the groups that we recommended vaccination for recently. So, you think about some of the other things that are high causes of death. I'll defer to our pediatricians if I don't get this right, but things like drowning and car safety and things that, we actively do things about. For the under 1-year-olds, it's, congenital anomalies and prematurity. Those are things that obstetricians really think about to improve outcomes. And we have treatments and we have interventions. And so, it just made perfect sense to add this to the list of preventative measures that we have to prevent mortality, to prevent children from dying in those groups.
So, Dr. Smith, what do you think is driving that decision, that 27% that we mentioned? What are those conversations going to be like for you in clinic?
Yeah, there's some amount of hesitation that's kind of existed around all vaccines, and I think the approach to controlling COVID, which has been so important, which has occurred in a few different facets between limiting contacts, general social distancing, and now vaccinations. There's been a number of families, individuals that have been somewhat resistant to some of those measures, and I think that there has been unfair politicization of things around controlling this epidemic. And I suspect that some of those people that are hardly against the vaccines are individuals that are kind of tired, fatigued with the efforts that we've had around COVID, and are kind of over it, if you will. But I think a lot of the data shows that it's still pertinent, it's still concerning, and I think the vaccine is one of those things that can go a long way towards mitigating risk, not just for children, not just for families, but for the greater community. And so those are of those things that I think make it really important to have all of eligible children vaccinated. I am a father of 2-year-old twins, and we're working to get in our children for vaccine as soon as possible. So that's the other question that I get very commonly is, would you vaccinate your children? And I'm like, I will do it as soon as at all possible. And we're trying to finish.
Great endorsement for the vaccine to hear that from you. Dr. Ault, let's talk about that fear factor. What are the concerns that people have as far as side effects go? Help us feel better about getting those kiddos.
Well, I think if you go back in time a little bit, you might find the same numbers about adults. There might be 20% of adults when we started the COVID vaccine recommendations for adults that didn't want to get the vaccine, and some of them will change their mind depending on a lot of factors. But 80% of people getting vaccinated would be a wonderful thing for most vaccines. So I think the fears are that we're going to identify something that's very rare. We've identified a couple of things. The clotting problem with the Johnson & Johnson vaccine is 1 in several 100,000 doses. The myocarditis in the male teenagers, is 1 in tens of thousands of doses. And we may identify something in children, based on the safety data we have now. That isn't a concern, but these first few months, we should know for sure, because there'll be a big rollout and there'll be plenty of data. And of course, we don't finish talking about these vaccines based on 1-2-day meeting. We have dozens of meetings because of the pandemic every year, and we'll continue to review this safety data, and it'll be in the news and on social media and other places where people can get to it.
So that work that you're doing is really helping those wait and see parents, that group of folks that are waiting to see. What else are they waiting on?
Well, there might be some element of, severity. If there's somebody in your school that's very ill with that this fall, that might tip you over into getting vaccinated. There'll be more data. If you're somebody that's really watching the news, there'll be plenty of more publications in the next 6 months, just like there were when we made adult recommendations. And so there'll still be a lot happening, even though the EUA was made, on Saturday.
Mallory, I want to bring you in. What are you hearing from parents after Saturday's recommendation change?
Yeah, so, what we're hearing in clinic is that parents they're excited. Just last week when I was rounding with staff, parents they're already messaging us and calling us. When are you going to have the vaccine in clinic? When is it available for us to vaccinate our child?
So talk us through and walk us through the process when a parent has made this decision. They said they're going to immediately come out to you. Where can they get it?
Yeah, so with the health system, we are offering the vaccine within a child's well-child check appointment, as well as we are also offering vaccine-only appointments. So families just can call, patients that are established with the health system can call our scheduling line, get an appointment. They can also MyChart the nurse to get an appointment. We are offering appointments during the day, as well as some Saturday morning and evening clinics to meet the needs of our patients and families.
I want to get to some community questions, and if you have them, please start sending them in. We want to get to those this morning. Haley wants to know, what is the difference between the Moderna and Pfizer vaccines? Because one requires 2 shots and the other requires 3.
Do you want to answer that? Or
I may let Dr.
Well, I mean, I don't know that there's a lot of difference. They're both effective in the clinical trials that was done, other than the 2 versus 3. It's been a little while since my children were this age, so I could see the appeal of 2-dose vaccination. However, we have added extra doses onto the adults depending on the data. I think the thing that we've said on the show before, is we're trying to fly the airplane and build it at the same time, and so the data will evolve. But there are similar technologies, similar efficacy, similar side effect profile. We don't usually make preferential recommendations for one version of the vaccine over the other. So the best vaccine is going to be the vaccine that you can get at your doctor's office, in the next few weeks.
So, Dr. Smith, Jana has a question. Curious for those kids under 5 or over 5 like hers. Any reason for parents to wait to get that booster if they've already had their 2 shots?
So I think, again, it's always important to think about the health conditions of the children that you have, the members in your family, and again, take that all into consideration and decide how you move forward with vaccination decisions. I will say I work within complex care and take care of a number of patients, specifically between that 5 to 11 age group that have a lot of medical conditions that puts them at risk for very serious complications from COVID and a number of different infections. And I think, again, getting the booster in that 5 to 11 age group for those that are eligible, I think, is really, really important.
Using my family as an example, so I have a 6 and a 9-year-old, both healthy but about ready to go into school here in a matter of weeks. And so do I get their booster? Do I go ahead and get that and get them lined up, ready for school?
And you
can tell me what to do. That's okay.
The boosters, I think, have been kind of moving along. And Dr. All, could you help me for healthy individuals from 5 to 11? It's universal boosters being recommended.
I would have to double check about that since I don't take care of that age group. So, but a fair amount, as you kind of pointed out, a fair amount of the morbidity, the children getting sick and the mortality, about half of it or 2/3 of it is in those kids with coexisting conditions. And so you really should probably talk to your pediatrician.
And that's something that
look it up on your phone.
That CDC website open, because I know initially the 5 to 11 boosters were prioritized for children with more complex medical conditions. And I apologize. I just at this time don't.
You do not have to apologize. You deal with a very specialized group of people, as do you, Dr. Alt. So it's okay to stay in your lane. You don't have to know all the answers to everything.
And we can always put that on the Facebook page.
Absolutely, absolutely. Jean wants to know, what is the percentage of protection from infection for these children's vaccines, and how long until it starts to wear off?
Well, it's going to be hard to answer the latter question because the trials have finished, and so they're in long-term follow-up, and so that's again trying to fly the plane and build it at the same time, getting answers like that. But the protection looked pretty good. It was in the 80% range, 60 to 80%, somewhat similar to what we saw in the adult versions. The confidence intervals are pretty wide around that because they were not huge trials, but it did look like it was protective and immunogenic. That means children make antibodies when they're vaccinated, and it looked like it had the usual side effects we'd expect of sore arms. And so it looked very similar to the first phase, the first publications about the adult trials.
All right, let's turn now to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control for our COVID count on this Monday morning. Good morning to you. How are you?
Hi, doing really well.
Good.
How's it going there?
Pretty good. When are you coming back?
I'll be back tomorrow. Yep.
Okay, we'll see you then. What do you got? What
All right.
coming out of this weekend? What are our numbers? Are they inching up a little bit?
The numbers have been holding steady to where they were at the end of last week with, over 10 now. We have 15 active infections, 1 in the ICU, 1 on the ventilator, 7 in that recovery period. Nationally, it looks like cases are really have hit that kind of plateau or are slightly trending down. So I think we'll be in good shape and, continue to hope that our cases, active cases in the hospital, continue to stay low and, of course, go even lower than they are right now.
Okay, 49 states, Dr. Hawkinson, pre-ordered vaccine doses for young children. Florida was the one holdout. Thoughts or comments on that?
Yeah. I think our guest said it a little bit earlier about the politicization of COVID-19 and this disease and vaccines. I saw a headline today that might be walked back right now, and I think that the providers in Florida are able to order that at this point for their pediatric patients. Just reading that article today. So I think it's going to be going back and forth, but it was probably more of a political ploy than anything at all.
Another question for you. Omicron, it's heard to be less likely to cause long-haul COVID compared to the prior variants. Thoughts on that? Is that true?
Yeah. This is just kind of one piece of data, one study. I think we need a lot more. It's an interesting finding, but I think the questions still remain and are still being investigated. We also know that Omicron maybe doesn't infect the lower respiratory tract or the lungs as easily as some of the other variants. And so these are somewhat minutia. Still, when you have so many people infected, as was with Omicron, even those small percentages or small numbers of going on to COVID create large, full numbers of those people that do go on to create long COVID. Again, interesting tidbit of information. The question is not answered. We still need to do more investigation on that.
Monkeypox has made its way to the metro. What do we know about that? What could that mean? I think we are all on alert, looking for it. Hopefully, you won't have to come to the hospital. We know that our health system and hospital, through our IPAC committee, has created systems in place, just like was with COVID initially. We are ready to see and treat those people. But again, most people are probably going to be seen in the clinics if they are having symptoms. Very, very few people are going to have to come to the hospital. So we'll have to see where that goes. We know that we work very closely with Wyandotte County Health Department, the State Health Department, and even Johnson County Health Department when we need to. And of course, we've seen throughout COVID, we've had a collaboration with our partners on the other side of the state line too. So I think we're all ready to evaluate and monitor for that, and we will tackle it when it comes. I think most importantly, it's going to be out getting information on how to prevent it and what to do if you think there's a suspected case, who to contact. But I think overall it should be fine, and hopefully will not be too impactful for many people at all. And of course, I have to ask you your thoughts on this authorization for those long time waiting for those kiddos under 5. Your thoughts and comments on that?
I think it's great. It's not good as we've seen vaccine hesitancy. We know children can be infected and affected, and we know it's less likely than older people or adults to have the severe disease, the hospitalization, even the long COVID. But we know that can happen to individuals, and if it's your child, you want to try to protect them as much as possible. Again, we know that a lot of children have already been infected, mostly through this Omicron wave. So that is essentially one kind of initial exposure to that virus where you're mounting an immune response. These next vaccine doses now are going to help codify and make more durable that immune response as well. So if you get infected or if your child gets infected, they'll have a lot better protection moving down the road, especially against severe disease and possibly even long COVID.
All right, hang tight because I've got some community questions already coming through for you. So we'll get back with you here in just a moment. But I want to get back with our panel discussing the authorization of vaccine for those under 5 years old. We have pediatrician Dr. Ryan Smith, Dr. Kevin Ault, OBGYN, and member of the CDC's ACIP committee, and also Mallory Leach, nurse manager of ambulatory and pediatrics. Mallory, how many shots will this age group need? We touched on it, but for those joining us, kind of explain to us what that's going to look like and how far in between will they need those shots?
Yeah, great question. So between the two vaccinations, so Moderna, it's a 2-dose series, 1 month in between the first vaccination and the second vaccination. Pfizer's a little different, so it's a 3-dose series. Patients will get dose 1. 3 weeks later, they're eligible for dose 2, and then 8 weeks after the second dose, they're eligible for the third dose to complete the series.
So what's it like for you to finally be able to administer shots now to pretty much the entire population who's eligible?
Yeah, it's a really good feeling, both as a nurse and, as a parent of a kiddo in this age group. You see parents coming into clinic and they've had one kid in the 5 to 11 age range and their younger one, and just to be able to see them finally be able to vaccinate their family starting at 6 months is huge.
Well, we hope you're going to be very busy in those clinics. Dr. Smith, I want to ask you, what else should parents be getting their kids vaccinated for? We know they're lining up. I don't like to just talk about COVID because when we have you here, it's a good reminder of all things that are out there that affect our children. So what do we need to know, especially as we make those appointments to get our kids ready for school?
Yeah, and I think that's really important. I think with COVID epidemic, we had, especially in the first 12 to 18 months, a number of children not coming in for the routine appointments and not getting the routine childhood vaccinations. So the CDC has our immunization schedule, and our visits in preventive health kind of aligns with those vaccination needs. So 2, 4, 6 months, we have a number of protein conjugate vaccines that affect some of the infections that can adversely affect children under 1 year of age. Once we get to 1 and 4, we have measles, mumps, rubella, varicella. And then as we transition into adolescence, we have HPV, we have meningococcus, and of course we have our seasonal flu vaccine. So one of those things that I think is so critical when you look at one of the, if not the most important breakthrough in modern medicine, definitely one of the most important breakthroughs is immunizations for saving lives, for controlling disease. And again, getting in to see the pediatrician or family physician for your children on a regular basis and getting all those vaccinations that are recommended is so critically important.
So how do you talk with the holdouts, the parents who still have questions? And I've always been, I have friends who are still slow to get the vaccine for their kids, and they love their kids just as much as I love mine, even though I've vaccinated. So how do we help those parents get there? What are those conversations need to be, not just in clinic, but really among our peers?
Yeah, and I actually want to start with that conversation because I think that is so important. And I think that has been one of the difficult discussions and kind of divides within the practice of pediatrics is whether or not to allow under-vaccinated or unvaccinated patients into your practice. And the way that I look at it, each time that I meet with the parents and the patients that are under-vaccinated, it's a chance for me to convince them to vaccinate. And I will say, for those patients I have in our practice that are pretty limited that are unvaccinated, I like to explain, we're going to talk about this at every visit. I'm here to answer any questions that you have. You may have seen articles, seen studies. Please bring those in and we can discuss those. And I think that's the thing, I want to hope that our families trust us as pediatricians at least to kind of have a open conversation. And I think that's the thing. There's a lot of information that's circulating around out there, and that's why we have our visits. That's why we are here as resources, as healthcare workers, to kind of have these discussions and navigate through these difficult things.
There's data for the HPV vaccine. Of course, it's been around for a decade, so we don't have that data for COVID. But you know, if you turn down the vaccine when you're 11 to 12 year old, if you're a parent, about 40% of those people end up getting vaccinated when they're still teenagers. So there's data that says your approach works. So that's why I jumped in there. So
well, you mentioned being politicized off the top, and there's been so much around vaccine shaming, and I love what you said. You said bring in your articles, bring in your questions. It's about educating people and bringing them along, right?
Yeah.
And you have the same issues, Dr. Alt. I mean, just no
eye
rolling.
I was thinking about a patient, you know, a year or two ago. You know, I was talking to her about the human papillomavirus vaccine, and she said, well, I saw on the internet that caused infertility. And I said, no, there's a wonderful study in the Journal of Pediatrics that says that's not true. And she said, why do they let people put stuff like that on the internet? So that's why I was laughing, like, why do people put that kind of stuff on the internet?
It is frustrating, though, but I love how you just go to the D word, data. Here's the data. Read the data. Hey, if you don't believe me, read the data.
And she changed her mind instantly based on the data. So that's why I was kind of
that's it. Just
laughing under my breath there a little bit.
Anyway, I want to check and see if we have any reporter questions today on the line. Okay, we do not. Dr. Alt, we've got 5 minutes with you because I know you need to get to patients and meetings and all sorts of things. So I want to ask you, what are your thoughts about how we talk about kind of moving the needle? This group, this age group, now everybody is included in being able to be vaccinated if they can. So how will this change our vaccination rates? Okay.
Well, I mean, I think we're going to need data. You know, if you go to the COVID tracker, part of the CDC's website, you'll see data about adults and teens, you know, that this vaccine has been outstanding at preventing hospitalizations and deaths. And we're having tens of thousands of children in this age group been hospitalized in the past few months. And so, you know, we'll have that data eventually, and maybe even, you know, by fall or the time that people are going into school and thinking more about this. I think the other thing I thought about, again, reflecting that I'm an obstetrician, you know, we have data now that the first 6 months of life, you're protected from COVID if your mother's vaccinated while you're pregnant. So yet another reason to get these vaccines in pregnant women. So if you don't mind me making a plug for my specialty. So I mean, you know, it's been interesting to see how the data evolves in that group and other groups over the last 18 months.
We love having you on. We hate that you have to leave us early. Anything you want to add before you go?
Why don't we add that booster recommendation to the Facebook page after one of us looks at it? Yeah. Okay.
We're on it.
Yeah,
we could do it.
I have to sneak off.
You sneak off?
They're texting me.
And we will see you soon. And I want to turn to Dr. Hawkinson because there's a question now from Debbie. I had COVID 2 months ago and have been fully vaccinated and double boosted. If I was exposed to COVID over the weekend, should my immune system keep me from getting infected again? She sounds pretty protected.
Yeah, I mean, what we've seen is that with the vaccine, we know that you do get some minimal protection against infection. Really the strongest at 4 weeks after that spike exposure of the vaccine dose. But you know, you are still probably protected. How much are you going to be protected against infection? If you were infected a couple months ago, that was probably BA1. That was probably the original Omicron. Now what we know is coming through are other variants such as BA4 and BA5. You should be very well protected against hospitalization. About protection against infection after exposure, you probably do have some minimal protection for that, but still monitor for symptoms and obviously test if you develop some symptoms.
Joellen wants to know, Dr. Hawkinson, are those hospitalized? Are they being discharged sooner now? Are you seeing any trends with that?
I don't know that we've looked at that, the length of stay data. I think we can certainly try to delve deeper into that. Obviously, it's easier when we have 6 patients versus 15. And I don't know what our trend has been. I thought that when we last looked at that, there was a trend towards more of a 1 to 2 day shorter length of stay, but I don't think we have that data right now.
Okay, I have a question for Mallory from Jacqueline. She says, I am definitely getting my 2 and 4-year-olds vaccinated, but would love to time it for the ultimate protection. I think this is really an important question, timing. We had COVID in January, so have some protection. Is it best to have them fully vaccinated by the time they go back to school or wait as we get into the winter months so that they would be best protected during that time period? What are your thoughts?
That's a really good question. I will probably also need Dr. Hawkinson and Dr. Smith to chime in too from a physician perspective. But from a nursing perspective, a parent perspective, I would vaccinate as soon as you can.
Dr. Smith, I think you mentioned that. If you can get it, get it.
Yeah, and I think the timing is kind of challenging, and I think that is certainly something that a lot of people have struggled with, that they have had recent infection. I think all the data shows that really once you recover from the infection, getting the vaccine somewhat soon after that is appropriate, because again, we actually had Barney Graham, who was one of the KU graduate and one of the developers of the mRNA vaccine technology and assisted the COVID vaccine development. And he talked about how, again, when you have a native disease and you have induced immunity from vaccination, you have the ultimate amount of protection. And so I think, to Dr. Alt's point, we'll still see how much time we have with protection with immunization in the 6 month to 5 year age range. But I honestly think it's appropriate to get vaccinated as soon as you're able to. We still are seeing lots of serious cases of COVID, but we have this ability to get protected, and I think that it's a time of great risk and really appropriate to get started now.
Dr. Hawkinson, anything to add?
No, I think that's good. Never miss that opportunity to vaccinate. Get that full durable immunity produced by the vaccine doses. And then you'll have protection. Again, I think what we have seen early on and still through this is that vaccination does offer a minimal amount of protection against infection, but really what we're looking for is protection against those other things, and that's hospitalization, severe disease, some benefit of reducing long COVID as well. And so getting those vaccines and those doses in appropriately is going to be the best thing moving forward.
All right, Dr. Hawkinson, Kathy is worried. She said she thought she had allergies starting up on Saturday, tested negative, kept 4-year-old granddaughter Saturday night. During the night, had fever spikes. She feels horrible. She tested. She had those fever spikes, not the granddaughter. Next morning, she tested positive. She's had all of the vaccine except the second booster. Do you think she'll get it, the little girl? I mean, I know it's the crystal ball moment. I think it's just people looking for some sort of, some sort of words of hope that she may not get it, especially since she's under that age group.
Yeah, I mean, it sounds like if you are watching a 4-year-old overnight, and I think that was the scenario, there's probably quite a bit of substantial risk there of spreading it. We know that viral load is highest in that first 1 to 2 days before symptoms. It goes down after that first 2 to 3 days. We have good data to support the fact that you probably do shed less if you're vaccinated and boosted. But this sounds like a fairly high risk scenario. Just to monitor that child and get that child tested if any symptoms should arise, I think is going to be important. And certainly I'll defer to my pediatric colleague for any other kind of clinical questions about that.
Well, Dr. Smith, I think this is the moment a lot of grandparents have been waiting for, and because kids have had to stay away from their older grandparents who may be susceptible to getting ill. So this is really good news for people like this viewer who won't have to worry hopefully soon, right?
It's true. And, I think, again, it's all on a spectrum of risk. And I think, again, you always need to take exposures seriously when you have viral symptoms. Consider it to be COVID until you can clearly say that it's not. But I think one thing that I've seen in my personal and professional experience is like you can get exposures without necessarily being affected, but having fair precautions is just so important.
And she really didn't have any way of knowing, but she did get tested, so that was really smart. Hey, Dr. Hawkinson, Betsy says, in donating blood, I was determined to be reactive plus and able to donate plasma for convalescent plasma. She wants to know, is that a treatment still being used to treat COVID, and should she seek out and donate plasma?
No, very little. We have much better therapies now for that. I don't believe that the best of our data showed really too much benefit from plasma. If there was, it was a certain high concentration of plasma, high antibody concentration of plasma. But in general, we have other therapies. It's not used routinely. I am not even sure, unless in very compassionate use circumstances, we are using it here at the health system. I don't believe we've used it for quite some time.
I want to get to our final thoughts from our guests. Such a great conversation. And Mallory, I want to start with you. Just what is your message? What do you want parents to know as they head out to these clinics, fully stocked clinics, ready to give out shots? What do you want them to know? And just any message for our community?
I think that, the nurses and clinicians, we're here and we're ready to vaccinate patients once those vaccines arrive. And, it's our job to help take care of patients and families and protect our community. So we're excited.
Thank you so much. Like I said, I hope you're going to be very busy in the next coming months. Dr. Smith, what is your message? I mean, we know it's easy to send a message to parents who are going to run out and get their kids vaccinated, but what about the people, like we talk about that wait and see, those people who are still on the fence and are still trying to seek answers? What do you want them to know, and how do we want to help bring them along?
Yeah, and I think, again, there are unfortunately a number of people in our society, I think, are over COVID, and I think the important thing is we're getting closer to getting past COVID and getting to this stage in which we are truly endemic. And I think with that, vaccinating children, vaccinating the greater population is this great way to get to getting past COVID. And so there's lots of very selfish reasons for your own protection to get vaccinated against COVID, but I think that understanding we're so close as a greater society to getting past this epidemic, I just encourage everyone to take that step.
Keep pushing through. Thank you so much for your insight today. We always appreciate you. Dr. Hawkinson, final thoughts.
Yeah, just the same thing. I think everybody will be excited. Parents themselves to try and help keep their kids from having risk of long COVID and hospitalization, even though it is a smaller percentage. It still does happen, and it's horrible when it happens to your child. But also, as we heard from one of our guests about the grandparents, and now you may be able to have better or more interaction with the grandchildren and grandparents because it wasn't being able to be done before. This is one more level of protection to help stop the spread of the virus through the family and through your bubble.
Dr. Hawkinson, thanks so much. We'll see you soon. Live now out in Overland Park, where the health system is performing its 200th IORT procedure to treat early stage breast cancer. Alexis Del Cid is at our campus at 435 and Knoll. Good morning, Alexis. It seems to be another great day out there.
Jess, this is a huge day for the University of Kansas health system. As we said, this is the 200th IORT procedure. It's happening right now behind these walls. And joining me now to talk about the patient and the procedure is Dr. Savio, Dr. Carolyn Savio. Thank you so much for being here. You work in our radiational department. What is it like to be standing here for the 200th procedure?
It's incredibly rewarding to be a part of this team. Janet lives over an hour away, and if we didn't have this IORT procedure, she would have to drive over 2 hours, per day, every day for 3 to 4 weeks. So this is the most convenient, easy way to receive radiation treatment to get her the best outcome after having a lumpectomy.
And these are the stories that we hear from every patient, is what a life changer this is, because it makes the treatment so much easier than the grueling drive day after day. Can you explain to people who are unfamiliar with IORT exactly how it works, doctor?
Sure. So IORT stands for intraoperative radiation treatment. And instead of having the lumpectomy and the sentinel lymph node biopsy procedure done and then wait for the patient to heal and then do the external radiation, which is typically given over 3 to 4 weeks on a daily basis, we can do it right here, right after the surgical procedure is done, so that potentially when she wakes up from anesthesia, she can be completed with all of her treatments with surgery and radiation completed in one day. and it just makes everything super convenient and easy. And, you know, it's being diagnosed with cancer is not easy, period. But having to deal with all the logistical things and entailed in getting treatment done, we fully realize that there are personal, family, work responsibilities that would preclude patients from being able to come from far away to get daily treatments like that. So we're thrilled to be able to offer this kind of service to our patients and provide the highest care.
Who is the ideal patient for IORT?
So patients with low volume disease, we're very selective on who we offer this to. We want everyone to have the most convenient treatment, but we would never want to undertreat a tumor. The typical profile that we look for is somebody who's older than 45 years of age. Low volume disease, meaning we want the tumor to be less than 3 centimeters ideally, and no other high risk features. So we want the tumor to be estrogen receptor positive. We want there to be only one focus of tumor. We want it to be without other high-risk features such as like what we call LVSI, which is something that we look for in the pathology report based on the biopsy. And of course, we don't want the lymph nodes to look suspicious on imaging.
When we were last here for the 100th patient, I remember speaking with her a couple weeks after the procedure, and she said she was back answering emails and doing work by the next day, and she was home in time for lunch. Is that typical?
It's very typical. Aside from the convenience factor, essentially IORT, you wouldn't be able to tell if somebody had just lumpectomy only or lumpectomy with IORT, in that essentially there are no additional side effects. You get the best cosmetic outcome, as well as a fantastic cancer outcome.
Dr. Carolyn Savio, thank you so much. Radiational oncologist, right? I want to make sure I get your...
Radiation oncologist.
Radiation oncologist. That's why she's the doctor. I'm just talking to her and interviewing her. This is such a huge day. Thank you so much for being here, and congratulations on your 200th patient. This is changing lives for so many people. Jess, I'm going to send it back to you.
Alexis, it blows my mind. Here we are at the 200th. We reported on the first during COVID, and it was so fantastic because, you know, here are people trying to stay home and stay away from others, and so it was so convenient, and she's doing great now. To see yet another patient being able to go through this again, it's great. So thank you for bringing us this morning.
It's very cool.
All right, and thank you all so much for being with us today. Don't forget, you can catch our shows anytime by logging onto Facebook, YouTube, and Twitter. Tomorrow, you have seen him on the big screen in some pretty iconic roles. Actor Brian Doyle Murray shares his health journey as a former smoker and now self-health advocate. We'll see you back here live Wednesday at 8 a.m. More than 55,000 people in Kansas and Missouri will be diagnosed with cancer this year. Coming up on the next Open Mics with Dr. Stites, the role genetic testing and tumor profiling could play in finding a cure. We'll see you Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.